This is a collaboration between the University of Calgary, Washington State University, and the Japan Racing Association. In this video, we will demonstrate a technique to temporarily induce laryngeal hemiplegia by injecting a local anesthetic directly into the cricoarytenoid dorsalis, or CAD muscle, using ultrasound guidance. This technique is intended for advanced practitioners and researchers. We would like to thank Brandy Millen for her help with the technical preparation of the cadaver larynges, Paul Godot for his help with filming, and all horse owners for their support with this project. We have no conflicts of interest to disclose. In a horse with a normal larynx, both arytenoid cartilages should move smoothly and symmetrically. They should abduct fully during inspiration, creating a wide, open rim of glottis with no narrowing. This video shows recurrent laryngeal neuropathy grade 4, where you can see laryngeal hemiplegia as the left arytenoid is fully paralyzed. During inspiration, it lags or stays partially collapsed towards the midline. This creates an asymmetrical airway, reducing airflow and producing the classic roaring sound that is heard during exercise. In clinical research, this can be modeled by temporarily suppressing the recurrent laryngeal nerve, creating a reversible form of laryngeal hemiplegia. This model allows researchers to investigate a range of cardiorespiratory conditions, including the effects on aerobic capacity and ventilation. The challenge, however, is that performing a nerve block of the left recurrent laryngeal nerve is technically difficult. The aim of this tutorial is to demonstrate how to transiently induce laryngeal hemiplegia by injecting bupivacaine directly into the CAD muscle using ultrasound guidance. This technique is intended solely for research purposes. This is the equine larynx. With the esophagus removed, the CAD muscle becomes visible. It is a paired muscle that has a right and a left component. It originates from the dorsal surface of the cricoid cartilage and inserts onto the muscular process of each arytenoid. Functionally, it is the only muscle that abducts the arytenoid cartilages. We first tested this technique on cadaver larynges. On ultrasound, the CAD muscle appears as a moderate echogenic muscle positioned just dorsal to the arytenoid cartilage. We injected 5 milliliters of methylene blue into 5 cadaver larynges. In all cases, the dye was visualized within the CAD muscle. To perform the block, you will need 2 to 3 people, 1 to hold the horse and 1 to perform the ultrasound and the injection. A third person can make the process easier. You will need clippers, scrub, and alcohol to prepare the site, an ultrasound with a high-frequency linear probe, alcohol spray, ultrasound gel, sterile gloves, and a sterile probe sleeve. For the skin block, you will need a 2 milliliter syringe, a 25 gauge 1-inch needle, and lidocaine. For the CAD block, use an 18 gauge 3.5 inch spinal needle and 4.5 milliliters of bupivacaine at 0.5% concentration. It's important to use a spinal needle as it includes a stylet and has a less acute bevel angle, allowing the needle to pass through dense tissue with more stability. Secure the horse in the stocks and clip the left side of their larynx from approximately their second tracheal ring to overlapping the caudal aspect of the mandibular bone. Start by palpating the larynx to confirm normal anatomy. Identify the dorsal aspect of the larynx, then the cricoid cartilage. Moving slightly rostral, you'll feel the thyroid cartilage. Place your ultrasound probe with the marker facing forward in a transverse plane. You should see the cricoid cartilage and the thyroid cartilage. Slide the probe slightly rostral and dorsal, adjusting your angle until the arytenoid cartilage and the cricoarytenoid joint appear. The CAD muscle is located dorsocaudally to the cricoarytenoid joint. Clean the skin with alcohol and inject 1.5 milliliters of lidocaine subcutaneously using the 25 gauge needle. Then perform your aseptic prep. If using a sterile glove, fill the glove with gel, insert the probe, and remove any air bubbles. Be sure to note the ultrasound marker before sealing the glove tightly around the probe. Stand on the horse's left side facing caudally with the ultrasound screen to your right. It can be helpful for the person holding the horse to extend their head slightly. If the horse is quiet, they can rest their head on your shoulder. Re-identify the CAD muscle in ultrasound. Once confirmed, switch the probe to your left hand. With your right hand, insert a sterile 18 gauge 3.5 inch spinal needle almost parallel to the probe. Move the needle slightly in and out to visualize it on ultrasound as it passes through the skin and the muscle. This confirms proper placement. Remove the stylet, attach the syringe, and inject 4.5 milliliters of bupivacaine. You should see the spread of fluid within the muscle on the ultrasound. This technique was tested in 9 thoroughbred racehorses with normal laryngeal function during maximal treadmill exercise. All horses had grade 4 laryngeal hemiplegia within 5 minutes of injection and performed maximal treadmill exercise with grade D laryngeal hemiplegia, which was confirmed using overground endoscopy. Laryngeal hemiplegia persisted for more than 70 to 90 minutes, however, it was not rechecked beyond 90 minutes. All horses were examined a week later and were confirmed to have normal echogenicity in the CAD muscle and normal laryngeal function at rest and exercise. Injecting bupivacaine directly into the CAD muscle under ultrasound guidance is a practical technique for inducing transient laryngeal hemiplegia that is sustainable during maximal exercise.